So in this session, we are going to think or learn about birthing or birth planning. We always take this event as commonly known as delivery or labor process, which all of you or most of us associate with the feelings of fear and pain, right? But I will tell you that babies are not pizzas to be delivered. They are meant to be born. And that is why at Vardhan, we say this beautiful process as birthing. Delivery is something of like some luggage is delivered or some things are delivered, right? Babies are not that. Babies are the beautiful gift to you from the side of universe, which you have asked for, which you are nurturing for, and they are going to meet you at this beautiful moment, right? So let us see that how we should look into it. So what is birthing actually? It is the process of meeting of mother and the baby first time in this world. The moment child is born, mother is also born. Whether it is first time, second time, third time, or multiple times, but every time experience is totally different because you are giving birth to a unique soul or unique baby every time, right? So let us see that why we associate with this feeling of fear. Because most of us say, okay, birthing means fear, lot of pain, lot of stress, lot of anxiety is there. Why? Because we have been conditioned like that. Okay. From the beginning, we are born or we have been nurtured by our parents, our neighbors, our society, our friends and relatives, or the things which is happening in the surroundings, like movies or the stories, whatever we have gone through, they have depicted this thing as something which is very, very painful, which is very much full of fear, right? So the biggest factor for the pain during this process is underlying fear, which has been there in us for years and years. And that is the thing which causes pain, not the actual process. Because if you understand the process correctly, you will say it is a physiological process. And then this source of fear is innate because we have been conditioned like that. This has been a result of our childhood learning and conditioning of our brain like this. But let us look at is this beautiful process. So let me just show you this small video, what exactly is the process of birthing is. Just see this beautiful thing. Baby is inside the uterus. Uterus contracts and relaxes. The downward opening opens up. Baby comes out. It rotates its head and it just gets slipped through. We just need to support this beautiful process. We don't have to do anything from outside, actually speaking. We are just supporting the mother's body. So that is all this process is actually. Now, let me just stop this sharing and again I have to start this. So did you see the process? This is so beautiful, right? Now, let me just, why this is not flipping. Yeah, it is again showing anyway. There's no harm in seeing it again because this is such a beautiful process, actually. See, so beautifully, the uterus is contracting, relaxing, opening up, and that's it. So we have to aid in our this body's natural action. One minute, give me just time. So now what should I do? We saw the process of birthing, but as a new mother, definitely anxiety, pain, and fear will not go in 1 second, right? Again, it just pops in, right? So what should we do as a new mother? So let us see that what should we do. You have to inquire about birthing options wherever, whichever hospital you're going. So what are the kind of birthing options available, right? You need to decide your birth plan because it is the combined plan by you and your baby. Not somebody else should decide, but you, your baby, along with your medical treating team, has to decide that how the birthing has to be there, how your baby is going to land up in this world.
Neetu ji, sorry to interrupt you. Would you like to record this?
Yeah, it is being recorded.
Okay.
Yeah, it is being recorded. Yeah. And we need to go for special prenatal classes because enough and more options are available to you, which prepare you for birth planning differently or separately. And you need to practice very, very simple things. Not very big things are involved, but you need to practice simple things like breathing in coordination, like understanding your body, like understanding the process of birthing. And you need to believe in yourself, your body, and your baby's power, as we said yesterday. Okay. So now next what? A small theory about your uterus, how your body is so intelligent and how your uterus is going to work for this process. So what happens is when the baby is ready to come out and everything is favorable, what happens is the uterus, which is the baby's house for 9 months, it is the strongest muscle and wonderful organ. You really don't doubt its intelligence. It is having lot of muscle layers which are in different form. It is not same time, same layers. It is not like that. And it is arranged in such a way that when the upper layers contract, the upper part of the uterus contract, the lower portion gets dilated. It is designed like this. You are not doing anything specific for that. In fact, you are making this process difficult by getting afraid, by getting anxious, and by stimulating your stress hormones. When the stress hormones in the body get released and released and released, what happens is they result in contraction of the lower part. And that makes it difficult. That makes it even more painful. And that makes the process prolonged. So as we showed this slide yesterday, initially this part, this called cervix, is not open because it is closed. But as the process of birthing takes progress and it progresses further, what happens is with the upper part contractions, the lower part starts dilating, and at the end, it becomes fully dilated and the baby comes out. That is what is going to happen, right? So now what happens when you go through the process? When the things are ready, you have some pains, you come to the hospital. We admit you in the labor room, which is either on the elective basis or emergency basis, depending upon the situation. Then what the obstetrician like Dr. Nishiji is going to do is she is just going to assess you. That's all. She is going to assess whether you are ready for birthing or not. And after that, we decide whether this process has to be helped by using some medicines or it will progress by itself. If needed only, we will give medicines. But if not needed, we will just let it go as it is. And our responsibility is monitoring the baby well-being. So we monitor by some of the instruments and we make sure that baby is well. Almost all babies or all cases, we ask or we try for normal vaginal birthing, which is the most physiological way. In some cases, few cases, maybe I will say around 10% cases, maximum that too, sometimes you may have to go for the cesarean section if it is really indicated. So now let me tell you that in this particular session, we are going to tell you about a visit to the labor room. I do not know how many of you have visited to the labor room when you go to the hospital, but many of the hospitals, they have a plan around third trimester or 7th to 8th month, we make the patients go to the labor room so that their anxiety comes down. They make it more normal and they educate you regarding the process so that the fear of unknown goes away, right? And you are more relaxed. So this is our labor room in our hospital. Every hospital will have a labor room. And you must actually make a labor room visit. This is my recommendation that we should go to the labor room visit, not to get more scared, but to get through the process more easily. Okay. And when you enter into the labor room, just see that there is usually a nursing station where the nurses are doing their jobs. They are monitoring the patients and all. Okay. And these are the individual beds where the patients are getting monitored. So that is all. That is just like any other big room where the beds are there, people will be monitored and they will be doing their work. Now, what happens after admission? As a new mother, we are always worried that what will happen to me? What will the doctor do? Although you are telling all these processes, but when it happens to me, how will I feel? Right? So let me tell some procedures, but Nishiji will explain it more in detail. But what happens is when you get admitted to the hospital, we see the situation, whether you are ready for birthing or not. And that situation assessment is by clinical examination as well as by internal examination of your body. And we see whether you are ready or the baby is really making its way out to come or not. Then sometimes we do stripping. That means we just swipe the fingers around it so that the process of hormone release and the other things gets augmented. That gets little bit accelerated. Sometimes we give medicine like oxytocin, which is again to increase the rate of contractions so that the uterus contracts properly and the progress of labor happens. Then what else? As yesterday we talked about, we frequently monitor the vitals. We frequently look at the ultrasound, looking at the fetal tone, fetal heart rate. It is called as NST. Sometimes the instruments are being used to measure the fetal heart rate. And we make sure that bowel is empty so that there is no obstruction to the delivery process. So we give enema so that your bowel is empty. And we do the shaving of the private part so that the later stitches and all, they don't hurt you. So that is the usual process in the labor room, which happens to anybody who comes to the labor room. So don't get scared of these things. These are the normal things. But most of the times we get scared. What will happen? What will happen? These are the things which is going to happen, right? And these are the different types of labor codes, or sometimes there is an inbuilt OT also, where they can take you for a cesarean section in case of emergencies. And then there is a lot of instruments are around for monitoring. It is not unusual. There is a bed for the baby to be delivered, and so that the baby can be taken care of. So it is good when you have a visit to the labor room, right? And after some time, final waiting will be over. Your baby will be in your hands by God's grace. And this is our baby viewing room, where we showed all the relatives, the babies, because they are waiting for the baby to come. And we make them sit and take the final photo, first photo of the baby with the relatives and friends and mother, father, grandmother, and all. So that is all is going to happen. And it's going to be the biggest moment of your life and baby's life as well. So we should plan to celebrate it. We should plan to welcome our little baby, not engrossed in our pain, our fear, our anxiety. We should not spoil this moment. This is the beautiful moment. We should try to celebrate. And we are going to tell you that how the things can be taken as a positive birthing experience, and all the things are going to come in the next sessions. And with that, I will stop here, and